More than 13 million people in the United States have survived cancer. But as most of these survivors know, life-saving treatments like chemo and radiation leave them weakened and debilitated. Now, a Massachusetts-based company is offering specialized care to get survivors back on their feet sooner. Carolyn Aldridge discovered she had cancer completely by accident. In her rush to catch a train, she was hit by the closing doors. Hours later, she noticed a lump and assumed it was bruising. But then that lump started getting bigger.
I'm waiting for them to say, oh, we're going to aspirate, we're going to take the bruised blood out. To my surprise, they told me it was cancer.
The 51-year-old was treated for an aggressive form of breast cancer, including a mastectomy and chemotherapy. A year later, her doctors gave her a clean bill of health.
You're done. We'll see you in 6 months. And I literally was like, okay, what do I do now? How am I supposed to feel?
Aldridge was exhausted and says no one prepared her for the challenges brought on by her treatment.
No one said you'd be doing your daily routine of shopping and all of a sudden you've just got to stop because you can't go a step further. But no one said that, told you how to manage those things or how to build your stamina back up so that you could get back to a normal life.
There were other things getting in the way of normalcy. Aldridge couldn't lift her arm due to scarring from her surgeries. While looking into physical therapy, she learned about the STAR program, which offers specialized rehab for cancer patients.
So bring your arm up. There you go. Good. And come back down.
After 2 months of endurance and strength training, Aldridge has more energy and can reach the top shelf in the kitchen where she loves to cook. She's also able to do simple things she once took for granted.
I can use a curling iron because I can put my hands above my head and not have to wait a couple of minutes or, the weight of the curling iron. I can do my normal activities now.
But what Aldridge values most is the emotional support she received.
The thing that stuck out the most to me, every single appointment, I was always asked, how are you feeling? They wanted to hear how I was feeling, not how my arm was feeling, but how am I doing?
And through it all, Aldridge says she's gained a new perspective.
Life is not over. It's just not. To me, it's just beginning. It's just beginning a little differently now.
All right, and with me now are Dr. Julie Silver, co-founder of the company that created the STAR program, and Dr. Ann Partridge of the Dana-Farber Cancer Institute. Welcome.
Thank you.
So, Julie, you actually got this going out of necessity yourself. You're a young woman. I think you were like 38 when you were first diagnosed with breast cancer.
Right.
I guess I was shocked to learn that this doesn't automatically exist, that you get some kind of therapy afterwards.
It does seem like it should, because certainly we offer rehab if you've had a stroke, been in a car accident, even had an ankle sprain, you get rehab. So the idea of not offering rehab routinely to cancer survivors is somewhat surprising, but we need to change that.
What happened with you personally? Did you have to go through a rehab?
I actually really needed it, but it wasn't offered. I had fantastic care. First of all, I loved my oncology team, had fantastic care. I have only good things to say about people in oncology. My colleague here, they work really hard. They care so much. And so I had wonderful care, but I did have to rehab myself, and it was very hard. I had 3 little kids at home. It was very difficult.
Well, now, does Dana-Farber have the STAR program as well?
So we can refer to the STAR program. We don't have it in-house, but much of what we do, we outsource for. But I agree with Julie 100%. There needs to be more focus on the aftermath of cancer therapy, and that's what the general field of survivorship focuses on.
Yeah, I mean, I can't imagine, because there's all these things. I mean, you can speak to that better than I can, but I mean, you often get this thing called chemo brain. You get paralysis in certain places. You've had radiation and burning and scarring, and what are some of those? Why does that happen anyway?
So cancer itself, and then the treatments, chemo, surgery, radiation, to name the most common, they can cause lots of late and long-term effects, is what we refer to them. And they can happen at the beginning, or they can happen even years beyond the cancer. And so we're just now, in the last decade, trying to figure out and sort out what those issues are, and then how can we intervene and do it sooner rather than later, especially if we can change the outcomes, if we can fix something before a problem happens or gets worse. But there are a number of them, and some of them we haven't even discovered yet, because as cancer treatments change, the survivorship problems change.
Right, and screening patients for the problems is really important. So screening patients so that we know early on what's happening, rather than waiting for people to self-identify and say, wow, I have a really big problem now. And we need to implement those types of screenings, identify the problems early, and then...
Well, so, I mean, does it go hand in hand with oncology now? I guess that's what I'm getting at. I mean...
Cancer rehabilitation does, exactly. I mean, it's being implemented throughout the United States, and people are really talking about it and thinking about it. Does it exist everywhere, and does everyone get it who needs it? No. But that's really what we're trying to do in our work in survivorship, is to bring not only cancer rehab, but all of the survivorship services that people need that really help them have a better life. And you know, that as the woman who went through the treatment exactly said, you know, the physical and the emotional, they go hand in hand. If you don't physically feel good, you don't emotionally feel good, and vice versa.
Right, the mind-body connection is huge, and I think one of the big issues that we can work on now, even with all the unknowns, is breaking down the barriers and improving awareness about resources that are out there for patients, so that they can be connected and be helped.
All right, the 800-pound gorilla in the room. Does insurance pay for this?
It does.
It does.
It does, absolutely. It pays for it the same way if you've been in a car accident, or you've had a hip replacement, or you had a stroke. It pays for it the same exact way. And so, you know, it doesn't take care of copays. People have copays still, and if you don't have insurance, that's a problem too. But in general, rehab is rehab. So if you have cancer, it's covered.
I mean, the psychological part of this, having not had cancer myself, I mean, I don't know how you ever get over the fear of recurrence and what you've been through and the dread of thinking that it's going to come back. I mean, do these kind of programs help you with that?
I think they do help, because people who physically feel better emotionally feel better, and that actually, there's a lot of new research looking at distress in cancer survivors and really tying the physical and the emotional together. People who are in pain, obviously, even if it's musculoskeletal pain, they worry that their cancer's coming back. They think, oh my goodness, that's cancer pain. Even if it's just, tendinitis, they think it's cancer. So it really can help a lot alleviate some of that worry.
And there are lots of complementary programs that focus primarily on the emotional aftermath of cancer and trying to intervene to reduce fear of recurrence, post-traumatic stress disorder, significant anxiety that can be very, very common, particularly in some populations after the diagnosis.
We're all looking for the next breakthrough, because it still seems very raw and Byzantine, the radiation and the chemotherapy. I don't have a better solution, but there's got to be one on the horizon here. Right.
Well, there's still, as I said to Julie when we were discussing what we're going to focus on today, I said, cancer survivorship is a good problem. It's a growing problem. And we still need to get a lot of people there.
Right.
Too many people still don't get to that component of the continuum of care. But it's a great group of people, large group of people that do have needs that we need to focus on. And programs like Julie's are terrific.
Great. Well, good luck to you, Julie Silver and Purchase. Thank you so much.
Thank you.
And that's it for Greater Boston. Tomorrow night, TNT Maddox is the first female Harlem Globetrotter in 20 years. She joins me to talk hoops. We also leave you now with TNT playing with her fellow Globetrotters. I'm Emily Rooney. Thanks for watching.